Hello everyone. Today I am going to make a small video on the basic surgical steps. This video is intended for postgraduate students and maybe for young gynecologists. Uh, Many textbooks have, of course, emphasized on the importance of having a good ergonomics even in open surgery. Ergonomics not necessarily means you should follow it only in laparoscopy surgery. How you hold an instrument, how you take a bite, how do you handle a tissue, it will definitely reflect on the quality of the surgery. So I'm going to give very basic guidelines, and of course you need to go through a lot of textbooks and read for further skills. Okay, now number one, we'll first go through the needle holder. Come close. Now needle holders, some people do use a curved needle holder, but I don't use. I usually use a straight needle holder. Now this is a 8-inch needle holder. Now what I suggest everyone is to buy a needle holder which has a cut. Okay. Now how do you hold any instrument, leave alone a needle holder? Now one ring finger will go into the one socket, the thumb will go into the socket, the middle finger will support and stabilize it. Now it is the index finger which will guide. Now this is the grip. Watch closely. Now I have seen many people holding this grip. This is not correct. It's not going to give stability when you take a deeper bite. Now this is the one standard grip which we have been following for centuries. Now another grip which is called as the palmar grip. Now in palmar grip you don't insert your fingers into the rings. Instead you hold like this. Your thenar eminence will do all the movement. Okay, now this is the movement. Now what is the advantage? It's not a very easy grip. You need to learn it, of course. What is the advantage? The advantage is that you don't hold and get stuck here. Now all the movements are in the wrist and your shoulders are not open. You don't have to open your shoulder. Now if you want to take a bite, you just do it, and then wrist movement will do most of the work. In deep pelvic surgeries and in vaginal surgery, this palmar grip is of very much useful. Okay, this is about the needle holder. Let us examine why we need to use this cut. Okay, now there is a small cut which will enable the thread to slip and it will not get entangled here. If there is no cut here, what usually happens is the thread will get entangled. Now I'll show you. Now when we throw the knots like this and slide the thread, you can see that it doesn't get entangled and slips smoothly. That's very important. Okay, now usually it has cuts on all 4 edges. They don't cost more. Only thing is you need to ask your manufacturer to supply these ones. That's it. So always remember to buy the needle holder which has a cut at the box. Now curved instruments, be it an artery forceps or a scissors. Now remember, a curved artery should never be used like this. Now if you have to use like this, and straight artery will also make the same use, but whereas the curved artery is intended to be used with the concavity towards the surgeon. Okay, now that allows you to visualize the tissue, number one. Number two, if you have to take a suture, it doesn't obstruct your vision. So concavity of the artery forceps or a scissors have to be towards the surgeon. Okay, that is very important. Now if you use like this, it's not correct way. You have to use it this way. Okay, it has to be used to concavity towards you. Okay, now most of us are not aware that instruments, 8-inch Alice has a different use than of a 6-inch Alice or a 4-inch Alice. Now the deeper your surgery, the longer the instrument should get. If you are doing a pelvic surgery and you are struggling with a 6-inch Alice instrument, that's not the correct way. So you have to have a sufficient length. Okay, we need to be aware of what are the length which manufacturer is giving you, and accordingly use them. Okay, now most of the time it is preferred to use a sturdy Mayo scissor to cut your sutures. Now you can as well use a Mesenbaum suture to cut the sutures, but the problem is the tip will get blunt very fast. So it is usually just to differentiate, and because Mayo scissors are little sturdy and tough, so they are used to cut the sutures. Okay, now last thing is about the thumb forceps. Now thumb forceps, I have seen many wrong grips. Some people try to hold like this. Okay, the right grip is that the either your index finger or your middle finger will control the movement. Okay, now initially some people find it difficult to use thumb forceps, so they tend to use Alice or artery forceps instead. But in a fine surgery, it's always good to learn proper usage of thumb forceps. Now another thing, even if I am handling a bladder, I use the toothed thumb forceps. I use plain forceps only if I am handling a bowel. Okay, because the grip is better and it is also gentle. Now sometimes what happens is, if the grip is not good with the plain forceps, you tend to crush the tissue, which may actually cause more damage. So I always, except for handling the bowel, I use the toothed forceps. Of course, it's a personal preference. Now the last segment of this video, we will see how to hold the needle with the needle holder. Okay, whether you are using this grip or whether using this grip, it's up to you. Now remember, all the instruments, irrespective what it is intended to be used with its tip. Okay, see this scissor also, it is intended to be used with the tip of the scissor, not like this. Never cut like this. It's always, tissue had to be cut like this. Okay, with its tip. Now then coming to the needle holder. Now you will hold the needle holder with the tip of the needle holder. Okay, now whether you hold towards the tip or the eye, it depends on the tissue to be penetrated. Tougher the tissue, you go closer to the tip because you get a lot of strength. Okay, now it's a soft tissue but you have a chunk to cover, then you go away from the tip. Remember, more away you go from the tip, your stability on the needle will decrease. So if you are trying to pierce the tough tissue with your grip away from the tip, then the needle will open. Okay, that's very important. So you need to balance. I have seen people using needle holder like this. This is the most, in my view, horrible way of using a needle and needle holder. So you always use with the tip, and you can use it to your advantage with the curved grip. Okay, now for example, sometimes I use like this to take a bite into the either deep tissue or in a vaginal hysterectomy. So you can change the curvature away from you or in the just perpendicular to the needle holder, depending on the tissue to be pierced. Okay, okay, taking the knot. Okay, now there is a lot of confusion how to square the knot. Okay, now remember, very easy. You take 2 throws and the thread was here, it will go to the other side. It is as simple as that, and your knots will be squared. You don't have to check, you don't have to see whether the knot has been squared or not. So simple. The thread, if it was this side, it has to move this side. So what you usually do is take a throw and change hands. Okay, and you can see, come close, you can see the knot is squared. Okay, so, and second thing is, once you square the knot, this is for the first knot. Okay, now once we take a bite, don't disturb the knot. Okay, so you have to leave this relaxed, and the subsequent knots are all single throws. Okay, subsequent knots are single throws, never double. The subsequent knots are intended to intended to hold the first knot, not to allow the first knot to get loose. I think I've covered some of the basic surgical skills, and I will try to show these skills on actual surgery sometime later. If there are any comments, do leave it in the comment box, and I will be very happy to answer. Please do share with your PG friends and young gynecologist colleagues. Thank you very much.